Hey everyone, my name is Dr. Ravi Kumar, or Dr. Ravi, and I'm a general neurologist. I practice in New York, and I see patients with all kinds of neurological complaints, whatever it is. Today I'm here to talk about memory loss and dementia. Memory loss and dementia is becoming increasingly common, especially as our population gets older, as we have more things going on in our lives, and whether it's about prevention or about a loved one who you suspect might be having memory loss, this video is for you. I wanted to highlight some common definitions, some things to look out for, and what to do about prevention and some early interventions that you can try to do as you make your way to a neurology provider or a general provider who can handle memory conditions. So first of all, definitions. What is dementia, and when does memory loss become concerning? Well, memory loss, and specifically dementia, is when you have interference with your day-to-day tasks. And specifically, it happens in a few different types of activities, what we call cognitive domains. So with cognitive domains, we have things such as learning and memory, so how to gather new information and recording and remembering new information. Behaviors, attention, getting lost and having problems with spatial cues, social awareness and social cognition. All of these different cognitive domains can impact people's day-to-day lives and can cause them problems with day-to-day interaction. When people have such a profound deficit that they're not able to do their tasks, that's what we call dementia. And dementia is associated with shorter life expectancy. So that's why it's a big deal. On top of causing functional impairment, lifespans overall also get shorter as well. Now, dementia is a certain severe manifestation of memory loss, but you can have milder forms of cognitive impairment. And that's also something to watch out for, and an early chance for intervention. Mild cognitive impairment does not always, but can be a preceding or a factor that leads into dementia. Now, with dementia, as I mentioned before, it's becoming increasingly prevalent, and memory loss in general is becoming more and more common. And, usually with age, we do see dementia typically, later in life, probably around 65 or older, but we can see dementia earlier. And so it's important to understand what are common causes of dementia and what kinds of things to look out for. Common causes of dementia, and we're talking about things such as Alzheimer's disease, Parkinson's disease, Huntington disease. Chronic medical conditions can cause dementia, strokes, drug use, certain types of illnesses, and certain types of infections. And now, you might be saying, well, are there other things that can cause dementia that are more subtle? And absolutely. These sorts of infections and chronic medical conditions, you may not think that they have a correlation with dementia, but they certainly can contribute and can be causative in some cases. So very important for you to meet with a healthcare provider and to talk about dementia. And if your healthcare provider feels that they're not comfortable diagnosing and treating dementia, you can absolutely ask them to refer you to a specialist such as myself or another neurologist or cognitive specialist who can help. Now, what kinds of things can you do to help prevent or treat certain forms of dementia on your own? Well, there are certain things that are highly correlated with improvements in memory, one of which is exercise. So high intensity exercise has been shown in studies to help with milder forms of memory loss and cognitive impairment, and it's absolutely something that I recommend to a lot of people who are trying to do things on their own. Nutrition is another big one. With nutrition, too much caloric intake has been associated with issues with memory loss and dementia, as well as undernutrition, too little. So this is something where talking it over with a healthcare provider and maybe with the assistance of even a nutritionist can be very helpful. So we've talked about exercise, nutrition, processed foods, and avoiding things that can, cause buildup of unnecessary, unwanted substances can lead to higher rates of dementia as well. So important to look into food and ingredients that go into what you eat every day. I highly recommend limiting drugs and alcohol. And when I say drugs, I mean things that are illicit drug use as well as alcohol use. Not that you can't ever drink alcohol, but excessive use or chronic long-term use of alcohol can lead to memory problems as well. Things like word games, word puzzles, Sudoku, other types of cognitive exercises, learning new skills and pushing yourself to learn new skills can be helpful for dementia as well. So I highly recommend, if you're having a little bit of mild memory loss, or if you're eager to prevent that from happening, always be learning, always try to learn a new language, new skill, whatever you've wanted to learn, make some time for it every day. As we go into prevention deeper, and especially for people who have more progressive memory loss, things to watch out for that can worsen the overall situation are falls, which frequently happen, getting lost, cooking-related injuries, behavioral changes that can lead to, perhaps emotional or highly aggressive or, actions that could be consequential and harmful. And, of course, going along with that, driving. So making sure that people are monitored and safe and being assessed by your healthcare providers. I hope this video and this talk is helpful. And, again, the goal here is to provide some education on what memory loss can involve, what dementia is, and maybe some preventative strategies for coping and preventing it from happening. And as always, make sure you reach out to your healthcare providers who can provide further guidance to your individual needs. Thank you so much for watching, and thanks for joining me today.